These are the people who should be here. Yes, this is the room. Now we're really excited to be sharing our reflections today on funding for sex worker rights and how sex worker leaders are building resilience and claiming their power right now. So because this session is about sex work, which can rouse a lot of emotions and opinions, we're definitely want your participation, and we want everyone to just feel grounded in listening and respect. I want to thank our co-sponsors, which is Red Umbrella Fund and Global Network of Sex Work Projects. We want to thank our panelists, who you'll hear a lot from, and our tech support, Christian, Geraldo, who's actually also a program officer at Estrella Foundation in their real job, and our amazing film folks back there so that we can capture what we're sharing today and share it beyond this room. I'm Sienna Baskin. I am the coordinator of the Sex Work Donor Collaborative. And, there is our mission. So we are a collaborative of funders, about 35 funders who care about sex worker rights. And we are really working for a world where sex worker movements are funded and where sex workers have a voice in the decisions that affect them. And where sex workers can be in partnership with other movements to make a more just world. So that's what we work towards. And we work towards that by really looking at the funding landscape and what's supporting these movements and how can we build that support up. So I wanted to show you the next slide just as an illustration of how broad the sex worker rights movement really is. So up above is the global network of sex work projects. So each umbrella, the red umbrella is sort of a symbol of sex worker rights. Each umbrella is a sex worker organization around the world. And those are just the members of this global network. And then down here below, one of our members did this survey and found that in the United States, there's really been a large growth of sex worker-led organizations just over the last 10 years. So that's 2015 and that's 2025. So it's very exciting to see people who have been in the sex trade, been sex workers, really organizing and speaking for themselves. But sadly, the funding is not living up to the potential that all of this beautiful work, could be. So let's go to the next slide, and we'll talk a little bit about the funding landscape. So really the largest, my work is global, so I'm going to talk globally. The largest source of funding for sex workers in low and middle income countries over the last many years has actually been from global health agencies in response to the HIV crisis. And those agencies are funded by governments. And so in particular, the United States, through their PEPFAR program, the US President's Emergency Plan for AIDS Relief, funded quite heavily, actually, sex worker organizations, even though the US's official policy was never to fund sex worker organizations, but actually a lot of money trickled to and supported sex worker organizations to build health responses and help protect the health of sex workers and their communities. A smaller but a very impactful source of funding also was the Dutch government, the Ministry of Foreign Affairs in the Netherlands, which funded strategic partnerships on HIV, but also on violence, on criminalization, and funded a lot of great sex worker work throughout the world as well. And then even bigger is the global fund for HIV. Has been a really important source of funding for sex worker organizations and just services, treatment, prevention for sex workers. And the US was the largest funder of the Global Fund for HIV. So what's happened in the US of the shutting down of USAID, the shutting down of PEPFAR, the US withdrawing from UN agencies has actually had a really big impact on sex workers and everyone else, not just sex workers, but from where we're sitting, that's a really big concern for us. Philanthropic funding from foundations is also an important source, but it's much smaller actually. It's the philanthropic funding for sex workers in 2021, according to Human Rights Funders Network, was only $15.6 million for the entire world, which is a very tiny percentage of human rights funding. And the funding that did exist was never enough for what the movement needed and could use to do their work. And that's been shown by scans that the Global Network of Sex Work Projects has done to find that most sex worker organizations are either have no funding or have just the most bare minimum funding to kind of do their basic functioning. But that funding did support a lot of these organizations, and it is now all really at risk or gone. So PEPFAR was abruptly paused. The Dutch government ended its strategic partnerships, and a lot of them are in the process of ending, and cut its foreign aid by 2/3. And we're predicting a loss from that, of $33 million in funding from those withdrawals. And some of the philanthropic funding is also at risk because of these withdrawals. So we think, as funders, that it's very urgent to support sex workers, both by advocating to bring these sources back, but also by looking for new sources of funding. And as usual, it's sex workers that are innovating in this area and leading the way. So we want to hear today from funders who are witnessing the impact of these funding cuts, but also from sex workers and leaders of organizations who are thinking outside of this box and building new kinds of sustainability. So that is what we're up to today. And we're going to start with my friend Ankit Gupta, a queer feminist and sex worker activist who happens to work for the Global Fund for Women as the manager of the movement-led approach, where they support participatory grant-making processes across freedom from violence and sexual and reproductive justice portfolios. So Ankit, I thought you could speak a little bit to how you've seen these changes affecting women's funds and just the funding ecosystem that sex worker organizations, especially in the global south, really rely on.
Thanks, Sienna, and hi everyone. Thanks for showing up on this very cold evening. I know it's late as well. My name is Ankit Gupta. As Sienna said, I work with Global Fund for Women. Global Fund for Women is a feminist fund that has been funding grassroots movements for more than 40 years. And what has been shared so far by Sienna is what we are hearing from all of our partners right now. All across the world, I think what many grassroots movements are asking is how long can we keep going like this? Because the funding landscape that many movements relied on for decades is shrinking very sharply. A recent analysis from Human Rights Funders Network showed that global development assistance is projected to fall by about $62 billion by 2026, 28% drop from 2023 level. And within that, human rights funding alone could decline by up to $1.9 billion annually. As we heard from Sienna, and as we are going to hear from other colleagues on the panel, for organizing, these numbers translate into very real impact. Programs are shutting down, staff being laid off, communities losing essential life-saving services. And we're already seeing how this is playing out. A UN Women's Survey showed that 90% of women-led organization and women's rights organization in crisis settings have been financially impacted by aid cuts, and almost half say they may have to close down entirely. And when these organizations are shutting down, what's also closing down with them is access to legal aid, access to health services, and a space that advocates for their human rights. So with loss of US aid and other ODA funding, we know people have lost access to essential services. I'm pointing out these numbers because it's very important. These numbers are very relevant. A loss of $62 billion in aid is a very massive loss when we know from previous data that less than 1% of human rights funding goes to sex workers' rights. We know sex worker organizing historically has been severely underfunded. Many relies on small team and community networks, and when large AIDS programs such as PEPFAR shrink, most restrictive, these groups get the most impacted. Sienna's question to feminist funds, I think what we're seeing now is most feminist and women's funds are stepping up. Today, 49 feminist funds globally work through a network, through different networks such as the Prospera Network for in the International Women's Funds Network, to resource movements. In 2024 alone, feminist funds made more than 7,700 grants, over $126 million directly to feminist organizations around the world. And more than half of this funding was unrestricted and core support funding. At Global Fund for Women as well, in this year of crisis, we are increasing our grant-making support and provide longer and more core support grant that is flexible, multi-year, and addresses the needs that our partners are seeing. We're increasing the speed we get the money out at. And a few years ago, we decided very intentionally, and Sienna probably remembers this, we decided very intentionally to fund sex workers. This is when we hired more sex workers as our team members. We wrote our position paper on sex workers' human rights and set up a separate portfolio for sex workers' rights. And since then, we've been part of the Sex Worker Donor Collaborative and have supported groups around the world. And funders such as Third Wave Fund have been very important allies in all of this. So what the movements need right now, and I think we should hear directly from the activists themselves, but what we are hearing is we know feminist funds can get the money out quickly and to much smaller groups in much more restrictive environment where getting money in is not very easy. So now is the time to trust whoever you do, get the money out, support the movements, because what we are hearing is the need is really dire and there are life-saving services being impacted, and the movement support is very important right now.
Thank you, Ankit. All right, so now we're going to have two of our speakers coming through the screen. And that is because the CSW is different. CSW is often a place where global activists can safely gather and advocate for rights, including sex workers. This year, the US has really created a very hostile environment for travelers, and especially for trans people, but really everyone. So not as many sex workers could come physically to the US and have their voice heard at CSW. So for that reason, we interviewed some sex worker leaders by Zoom so that their voices could be included here. So I want to introduce, pretend they're here, McLean Kioma, a radical feminist movement trailblazer and unapologetic former sex worker who has transformed lived experience into political power. And she is going to speak to us. She's the founder and executive director of the Alliance of Women Advocating for Change in Uganda. And she leads what she calls a grassroots uprising of women sex workers across Uganda's 6 regions. And then we're also going to hear from Naomi I'm going to mispronounce her name, Mabaria, who is the executive director of WANETHA, the Women's Organization Network for Human Rights Advocacy, which is another incredible organization in Uganda that was founded in 2008. And she works on holistic well-being, leadership development, legal and economic empowerment, and a lot of their work is on health and justice. And she said that she turns lived experience from the dust to the decision-making table. So they're both really incredible. So we're going to play a clip of their responses to some of these questions. First question, if you back it up, is I asked them how they're impacted by these funding changes. So that's what they're first going to speak to. And this is, we're starting with McLean.
And all of a sudden, then we receive an email from our grants focal persons, the different grants of persons, telling us we are terminating all your contract. Actually, at first it's an order, do not stop implementation. The email comes in on the 28th. It comes in on the 28th, and they are telling us to stop implementation up to 24th. First of all, 28th, but they are telling us some of us had already actually been working and also paid salaries. It was a very huge and confusing situation. And before we knew it, after a few weeks, we were being told we were being terminated. Now, as we're still trying to get to internalize this and get to terms to what we do, how we run the drop-in centers, the community safe spaces, the offices that have specifically been, just to remind you that we were providing integrated services, PrEP for oral PrEP for prevention, then HIV refills for everyone with living with HIV. We are talking about around 36,000 female sex workers in our database relying on these services, then also providing cancer, providing socioeconomic, and all these, most of these other services were a supplementary, relying on the HIV services. So when they told us they have terminated, we were like, okay. We planned, we say, okay, we have these other programs, like, for example, the economic empowerment, the cervical cancer, and can we reach out to the access to safe abortion? And we were saying, okay, can we reach out to these other donors and explain what is happening, if they can allow us to just at least cater for the safe space, but the continuity of services continues. And we reached out to SAF, we reached out to AJWS, we reached out to Wisconsin. They say, yeah, I think we can support if this is what is happening. People can continue getting the services. And then all of a sudden, another hard conditions come. One, if you're going to continue, you must delete yourself. Delete means that, for example, our work is for sex workers, WONESA is for sex workers. So for sex workers and by sex workers. And we started this just because we didn't have the safe spaces where we could convene, talk, laugh, hug, cry as sisters, but also access services without stigma, discrimination, and also being judged. And now they're telling you, okay, for at least 3 years backwards, you need to edit anything to do with sex work. You need to edit anything to do with post-abortion care. You need to edit anything to do with abortion anywhere, in your computer, in your social media handles, in everything. That became the hardest condition now to comply. We were like, okay, but this is who we are. How can we make ourselves invisible? We know we want the money. Indeed, we had a lot of funding, to be honest. We need the money. The communities are benefiting, but how can we delete? And then we was negotiating, okay, what if someone comes, maybe they have already done a post-abortion care, can we accompany, can we support? Don't touch that person, just escort them and tell them, please leave this space immediately. This is a safe haven home for a sex worker who has branded it as a safe haven. Why? Because they can walk in, take bath, take maybe water, a cup of tea and bread, or maybe even have lunch. Our lunch is basically portion and bid, but which is well made with a love portion. Love portions means with care, without discriminating ourselves. And then you're telling them, walk away. Now that was our biggest blow. And we said, you know what? It is hard, but we really have to make this decision. And we had to sit down. We explained to the members who were having the adherence safe spaces at the DIC, we told them, you know what, you're going to bear with us, but this is something we cannot do. You rather come here and not get a service, but be accompanied to a place where you can get a service, or get counseling in a space, but we cannot reject you or chase you away, because this place has been built by you. This place exists because of you, because of me. So we had to write our statement, and we told our implementing partners, with all these new conditions, we really appreciate, thank you so much. And just to say that some of our drop-in centers had initially hosted the ambassador of the US, and they were looking at as one of the organizations with the best community models. That one have managed to scale up services, improve adherence and retention, and of course in community innovation models that are specifically speaking to the needs and priorities of communities. And all of a sudden, the tables have been turned upside down. It was very painful, a very hard decision to make, but we had to write a very beautiful statement explaining to them that before we got the money, we came together. We had these priorities, these needs, these painful issues that we really wanted to put forward. Now you found us organized. You did not give us the money to organize. We really appreciate so much for the good work you've done, for the support you've given us, that we cannot forget. But at the same time, you have turned the tables upside down, and everything now is no longer what we dreamed would be. And that's how we wrote this statement, and we sent it to them. And we told them we were not going to continue. getting the funding from PEPFAR because it actually stigmatizes us, it's victimizing, but also it's actually undermining our efforts. We have worked with Ministry of Health at a time where we thought, can communities come together with Ministry of Health, Uganda's Commission and partners, implementing partners, and forge a way forward together as partners, as stakeholders, not as victims of the disease. But this is the time where everything actually was denounced. And the people even we thought would support us, everyone was scared and they said, we can no longer work with you. We were left with no choice. We had to let the service go. We had to let the money, PEPFAR money, small money, go out of that pain.
As a sex work-led organization that was established in 2008, we are only remaining with 2 years to make 20 years.
You know?
We say we cannot really, lose our focus because telling us to denounce ourselves, to denounce our identity, to denounce our realities, it really failed to work for us. And as my senior has said, we wrote to them. We wrote to IDI because they were giving us support from PEPFAR. Then we told them we are not going to adhere to your terms and conditions. First of all, the things they were telling us to avoid are the real things that we do on a daily basis. The people you're telling us to denounce, we are part of that community. Telling us to avoid things like talking about abortion, we had done a research on abortion, and they told us to remove that report from our website. Sex workers, every time and again, we are getting cases of death where our members are dying because of unsafe abortions. And you're telling us to stop talking about issues concerning abortion. To us, it was really a blow to us, but we said we are not going to accept that. We are going to continue working on the issues that are affecting our members. We are going to continue working on the needs of our members. If the money goes, let it go. And the money went. So we lost that funding, but we maintained our focus, we maintained our identity, because you cannot really tell us don't work on advocacy, whatever, because they had told us even advocacy issues, human rights work, agenda, whatever, those words, they never wanted to hear them. But this is the work that we do on a daily basis.
So let's bring it to the U.S. after hearing those powerful voices from Uganda. I have two lovely speakers in person. CJ Davison is a Black Queer Pause producer, director, and cultural organizer from Birmingham, Alabama. And CJ was the founding artistic director of the Birmingham Black Repertory Theater Collective, but they are currently the program associate at Third Wave Fund's Sex Worker Giving Circle, co-stewarding over $500,000 annually to sex worker-led organizations. We also have Kayla Gore, the founder and driving force behind My Sista's House, where she has developed programs that provide critical resources and support for women, LGBT individuals, aging populations, addressing the needs in housing, reproductive justice, and health access. So I want to ask the two of you to first just reflect on sex worker organizing in the U.S. and in the American South, where you're both hailing from. What are some of the key issues, and how has the politics of this moment affected sex workers?
So I'm Kayla Gore. My pronouns are she and her, and I'm based in Memphis. One of the key issues that we face in the South is that it's the Bible Belt. We continuously get reminded that when we come into spaces in the South, whether that's by people actually telling us that or them showing us that in their actions and the things that they don't do. A lot of things that I heard from the activists in Uganda are very similar to what we're experiencing in the South. And that's basically funders threatening to take away resources from communities that they know direly need those resources unless we conform. But what's happening is that organizations like My Sister's House, we're not conforming to those requests and those things because we know people will die. People will die, and that's just the bottom line. But what's happening is we're reverting back to when My Sister's House was first formed in 2016. And that's where trans people and gender nonconforming folks and people who identified outside of the typical spectrum of male and female were ostracized from organizations that provided life-saving services, whether that's related to healthcare, whether that's related to economic development of their lives, whether that was related to mental health resources. Organizations would not serve trans people. They would not put down that they serve trans people, even if they did. And that's what we're seeing at the beginning of this administration, the second term of this administration, is that organizations that provide a lot of resources to people living with HIV, people living with housing insecurity, people living under the FPL, are asked to not identify themselves as trans, are asked to either detransition to receive these services. And for a lot of us, that's a death sentence. That's what we're starting to see. And it's really weighing on the organizations that are like, no, actually, we're going to continue to do this. We're not going to change our social media platform. Our communication strategy is going to stay the same. And we're going to rely on the things that we've traditionally relied on, and that's mutual aid. That's how we've been able to fortify our resources at My Sister's House and build 11 homes in Memphis, Tennessee, against the regime that is like, absolutely not. But we have had the ability to leverage our allies, our true allies, folks who are in the city council, folks who are working for the mayor's office, to make sure that we have access to resources, and also telling us how to do workarounds where we don't have to weaken the way that we talk about our work, that we can actually continue to talk about our work and be as passionate as we would like to be and as passionate as we need to be in order to get the message across to folks. But it's going to have to continuously be robust. Like, people in this room are going to have to leverage a lot in order for other folks to be able to have what they need, and that's what equity looks like. There are a lot of people in this room that have been connected to My Sister's House work, like Estrella, Third Wave Fund, and the way that they fund us and other organizations like us is like no other organization I've ever had funding from. Where they're trusting our leadership that we're going to make the right decisions on behalf of our communities. And I'm going to pass it over to CJ from Third Wave.
Oh my gosh. Yes, Kayla, you ate that. Hey y'all, my name is CJ Davison. My pronouns are they, them. I am a cultural organizer and coming up in my third year of working into philanthropy, and I'm also a person that lives in a pause identity. I'm a person with experience in the sex trade. I also obviously live in a Black identity and a queer identity. And so coming to this work, has been really interesting. And I often think I sit like at an intersection where I feel like I have one foot in and one foot out. And when I'm reflecting on like what I see in the American South, I mean, all the things that you're saying, Kayla, is so true. And as like a grantee of the Giving Circle, I think My Sister's House is just such an example of like what's happening in the American South and how people are persevering. But something I did want to add on was like something that I am seeing is like fear in folks that have capacity to be funding this work or moving money in more ethical practices. And the fear is based in things that are not absolute in this country yet. And so when I hear specifically about like what's happening in other parts of the country, it really humbles me in a way and like empowers me, because I'm like, oh, like we actually still have time. We all still have time, but we have space and capacity in this country in ways that other folks don't. And so, and it's fear, right? Like there aren't, and it's changing every day, right? We see what's happening in Kansas right now. I was on the phone with Transformation Youth Group this morning, and it's scary what's happening in this country, but we still have space to be moving money now, like today, in really, really radical ways, in ways that don't have a lot of red tape, in ways where we don't even have to be asking for all of these ridiculous reports and stuff. And I think what I'm noticing is funders moving out of fear and flipping the script on their grantees and prospective grantees because they are scared of what's going to happen to them. And I don't care. Like as someone from the same lived experience, like you in your fancy house, Mr. Rich person with all the money, like get arrested. And like that, and like know that like that's what it's going to take though, like, right? It's like we have to be willing to like play and risk. And I think like as a sex worker, that's just something I have a very intimate relationship with. And I want to invite into rooms. It's like, let's get risky. Let's take the condom off, when it comes to funding now.
I love that. And let's be honest, the rich donor in their penthouse is not really at risk of arrest, for just funding trans people, just funding sex workers, just funding, so like redefining risk too. But thank you for bringing that in. So, and I think you all are already starting to transition to really the heart of this panel, which is how are sex workers responding to the lack of funding, to the changing landscape, and the lack of support from traditional funding sources, which has always been an issue. So Kayla, you started to talk a little bit about My Sister's House, but I'd love to hear just if you could tell us more about what you're building in Memphis and how you raise money to support it.
This should be easy. Maybe not. So I'll talk a little bit about some of our programs that we have at My Sister's House. One of our longest running programs is our T-Willow program, which is a program that's a CDC intervention that gets no government funding. That is for trans women who are living with HIV. And at the baseline, it's a way for trans women who are newly diagnosed with HIV to build a social support network so that they stay medically adherent. We've seen what it does as far as leadership development with our organization because we work with people who are living in our homes. We have started working regionally across the South in Dallas, in St. Louis, in Kansas, in Florida, in Atlanta, in Macon, Georgia, to build up leaders of color, build up trans women who are living with HIV or at risk of HIV. That's one of our longest running programs. Our other program is our Tiny House Project, and I'm sure some of you have probably heard of it, but it's a tiny house project that we started in 2021 during the Black uprisings and the beginning of the COVID-19, I don't want to call it a scare, but the COVID-19 virus, when we were calling it the coronavirus. It's when the early days, when we didn't know what was going on, but people were leaving the earth. So that's one of our programs that helps trans women, trans men, non-binary folks, cis people as well. And that's one of our strategies on helping to fund that project. And that's how we've been able to garner the support of our city mayor and our Shelby County mayor. They've helped us to build 3 homes so far. And that's only because we've extended our housing to cis people. And there's 2 reasons why we did that. One of the main reasons was safety for our trans folks who we are putting in the homes, because all of our homes are in maybe a 1 to 2 mile radius of each other, 7 of them on the same street. So we didn't want our street to become stigmatized like we've seen happen with people living with HIV, is that this is a trans street. All of the new houses on the street are, occupied by trans folks. And that has really, I think, made it easier for folks to transition into their homes and to actually stay in their homes. We've been doing the housing work for about 6 years now. We've never had anybody to move out. Which is really amazing. And I think it's only because we work with folks. It's not like we're just building homes and saying, here you go, the keys. We're actually working with people, with our architects, to actually design the homes, to make sure that the colors on the inside are trauma informed. So we are a certified trauma informed space through the Compass Initiative. But we work with folks on everything from the flowers that go outside to the interior and exterior colors on the home, because it's their house. I've been through a lot of processes with emergency shelter personally and transitional housing personally, and I know it didn't work for me. And it was coming into a space with all white walls. And coming home to a place with no furniture. So we make sure that we furnish the house for people. We want it to be their home, and we want them to have a sense of I belong here, because for a lot of trans people, we've been thrown away so many times from the age of 18 throughout adulthood. Especially once you get past being a youth, you really get trashed, in my opinion, because you haven't been built up to be a sustaining adult by 25. In a lot of these programs, it's just about checking off numbers. And especially if you're a LGBTQ person, most importantly, like if you're a trans person, you're really not getting that nurturing and that care. That's something that I didn't get. I had to detransition to get into that emergency housing and that transitional housing, only to be kicked out once I was like, oh, I'm in here now. I can actually, be who I am. That was not the case. I was asked to leave that house. But back to the funding part of what this program does is it's mutual aid. We have over 200 individual donors that contribute annually. Some of them are sustaining donors. So we don't necessarily rely heavily on any other funding source. Our houses are affordable, so the folks who are living in our homes pay an affordable rate under $750. A lot of our houses range from 400 square feet up until 1,300 square feet, so they're not all tiny. Our transitional units are. So it's really folks who are in our project, they are putting back into these homes, and they're on the path to home ownership. 3 of our folks have been in their house for 5 to 6 years. Next year, they'll be paying their house off, and the deed will be transferred over to them. So we're creating a really powerful model to create generational wealth within Black and brown trans communities that, I get chill bumps. I get emotional when I talk about it, because a lot of places have told me no. And we've been able to tell people yes, and not have a lot of red tape and a lot of bureaucracy. I remember being in housing projects and people were in my house every week, checking this and looking at this and having me come to classes that really took me away from building myself up. So we don't operate in that model. We operate out of a housing first. That's the most traditional thing we do, is making sure people have housing first, and then everything else we'll figure it out later. And I'll just leave it there. Yeah.
That was your question.
I'm sorry.
Thank you so much. It's very exciting, and I'm excited to share back to our Ugandan folks, and so many parallels between what you're doing and what they're doing in terms of really valuing people's need for housing and safety and ownership. But I want to take it back to you, CJ, and I want to hear about the Sex Worker Giving Circle, which we all agreed is a revolutionary intervention in philanthropy when we were preparing for this panel. So can you tell us how it works? And also what strategies, you have a more nationwide view a little bit of sex worker organizations. What are they doing, and how are they sustaining themselves right now?
I have the coolest job in the world, so I love talking about the Giving Circle. The Sex Worker Giving Circle is a participatory grant-making program, and we fund sex worker-led groups all across the country, all across the U.S. What participatory grant-making just means is that sex workers make the decisions on where our money goes. So every year, we have the privilege of working with about 7 to 9 sex workers from across the country that are selected by our advisors. Kayla is one of our advisors this year. Our grant is actually open. It closes on April 2nd. So if you know any sex worker-led orgs, please go to the third wave. Right, we got BPPP in the house, okay? I joined as a fellow in 2021. That's how I came to the Sex Worker Giving Circle, and Maurice and Chiclet were actually my PO and program people and led us through that process. And then after that, I was an advisor, and I was on the Third Wave board for a time, which was interesting. And now I'm the program associate, and I've been doing that for the past 3 years. But since 2018, we've had 49 fellows, and we've given away almost $5,000. It's 4.7, but 4.7 million. out to sex worker groups since 2018, right? And I think like what I get really excited about with the work is just like every year we get to meet some of the coolest people from across the country. And these aren't always people who are movement superstars or have philanthropic experience, like training folks from the ground up of like, what is philanthropy, first of all? Like, what is it? How does it operate? What are the stigmas and things that exist within our community as sex workers? And then they just get to make the decisions, right, on where that money goes. And I love it as a program associate because it's very competitive, right? There are more sex worker-led groups in this country than you would think, and Third Wave Fund is one of the only funders that specifically serves this community. And so, you know, and we only have so much money. So that's the part of my job I don't love, is that we can't fund everyone that applies. But we have funded over 97 groups since, so that's really exciting. I think something that I'm noticing right now, like, in this field is like, when you talk about like how folks are sustaining, like, through my own lived experience, through what Kayla's sharing, through what I know about our other EDs, like Marie Jensen, Ashanti, just like all of these folks that are running organizations, especially in the South, like sex workers are grabbing the bulls by the horns of our movement, and we're not waiting to be saved. And I think what you said about leadership development is really pertinent, because so many folks with lived experience are stepping up and really focused on skilling up their communities in addition to resourcing them, which I think is like something that should be focused on a little bit more across movement, right? Like, if we skill each other up, then we always have leaders that are ready to go, because as leaders, we're always gonna have a time where it's time for us to sit down, right? And who's gonna be that next person to carry the torch? So I get really excited about groups like My Sister's House, who are inventing new models, and leaders like Kayla. Yeah, I think that answers it. Oh, if you want to know more about the Giving Circle, our director of development is in the building. Marie's is here. So feel free to reach out to them after this if you have any questions, or maybe you want to support Third Wave a little bit. I will say, like, participatory grant making is a really cool model, and if you're interested, I'm super interested in talking about that. And one of the best ways to support participatory grant making is to, like, fund folks that already have really great models of that working. So just throwing that out there. Hit me up about the Giving Circle.
All right, now we're going to turn back to McLean and Naomi and hear how they have been building sustainability in a post-PEPFAR Uganda. So let's hear what they're up to.
Just briefly, slightly to take you a little bit back, in 2023, our government passed a Homosexual Act in Uganda, and very many key population organizations, key population-led, suffered the consequences. Many were left homeless, many offices were raided, many offices were burnt down by communities because of the anger, because of hate. And our work was one of the other organizations that was actually evicted by the landlord. So now coming 2025, then here, boom, Trump new administrative policies. Some years back, we were into a huge campaign where we were saying PEPFAR money kills sex workers, PEPFAR money in Australia. And somehow, by miracle, PEPFAR started funding us, which we didn't expect either way. But nevertheless, again, they denounced us, because it is very hard. Like Naomi is saying, all our offices for sex workers, key populations, most of us, we have branded who we are, because we believe in our reality, but also in our power. If I make myself invisible as an institution, then what happens to a community leader or a community member? So we thought that by reclaiming our power, we must do things that fit our shoes. How? When we were evicted, we had saved the membership funds. We had to invest this money and purchased 24 acres of land in one of the closest town in Ruero. And what we started after Trump started this, we have taken a few steps back to invest into agriculture and climate justice. So hopefully this year we shall harvest for the first time from our land. This land is for sex workers, by sex workers, and the land title is kept by our own partner, the human rights organization that fights for the sex workers' rights hereafter. Then also we registered our drop-in center as a clinic. Why? Because we also know that if we do not comply, again, that is the loophole, and we can easily be closed or shut down by the entire government. So if we formalize but also comply through the what we call the company that I don't want to use the word controls, but that is responsible for clinics and hospitals that's allied. We have actually registered. We have full-time hired a clinician and a nurse, and also we have an updated license which our work pays. Then also we are applying again for another certificate, another approval from Uganda AIDS Commission, which is also the president's office, which is under the president's office in Uganda. Then also we have registered our drop-in center in the local division where we operate. That is in Kampala, Rubaga division, meaning that in whatever we are doing, it's in line with what other drop-in centers or clinics actually operate. The beautiful thing is Ministry of Health has given us the mandate, at least to support, to be the community center, to supply commodities, and we are doing that very well, but we are saying we need that to grow beyond. And our dream on what I was just showing you here, it's a work community satellite. That ground floor is actually the hospital. We are just remaining a few meters away, a few times to reach that level. And this hospital is meant for the sex workers, key populations, any person that has been systemically excluded because of the laws, because of the bad policies, because of the bad guidelines within. This hospital is meant for us. And also just to say to start, we didn't have the money. Even before our first wife, AJWS, come on board to support the contribution, grassroots members had already contributed to the construction and purchase of that. People would pay 30,000 Uganda shillings, 50,000, any amount they would afford. And for us, this is the most golden thing that we have received from our own community. When we talk about ownership, when we talk about taking back power, power is for the community and by the community. There is no way you can own something unless you invest in it. Sex workers living who use drugs, they would contribute just 500 coin to say, for me, this is actually my contribution. And for us, that is something that has worked so well. Right now, we are no longer worried of paying rent. We are into the basement of that building, living our dream, very spacious. You need to see when, especially the trans women and of course the sex workers, when they come. It is something very beautiful, but also even as we can't believe that actually sex workers have built something like this. Very tangible, very beautiful. Communities, like seriously, it's a dream coming to reality. And again, like I said, the reason we chose that path, we wanted the world to know that we are not victims. We are not the disease. We are not the vectors of the disease. We are not poor. We are not. We are women, feminist, vibrant, and we are phenomenal women that all we need is an enabling environment so that we can thrive.
So we are integrating our services. We are giving a comprehensive package to our members. If it is a community outreach, we ensure that it is integrated. Everything you're able to provide in that single visit. When sex workers come for services here, we ensure that they get a comprehensive package of services. So there, we have seen it is reducing on the costs, because we are able to give that, using that holistic approach. Then our drop-in centers, we are registering them as community health clinics, and in a few years there will be community hospitals. So for these services, HIV services that we have been giving for free, what we are doing, we are going to ensure that the general medication is charged an affordable fee that will continue supporting the operations of the organization and the services that we have been giving to our members at a free cost. But we need to charge the general medication to raise that small money to keep the HIV and GBV programs to keep running. So those are social enterprises.
Absolutely. Yep.
So we have identified a partner called Capital Solutions, and they're helping us to really work on social enterprises, because for them it is a social enterprise and they have done it well, and they support organizations, NGOs who are doing social enterprises to ensure that the social enterprises thrive. So with that, we are sure our social enterprises are going to thrive. Then we're also encouraging community-led financing or community-led, fundraising. We have our members here who contribute on a monthly basis for the work of the organization to continue. So previously, we thought that we have to wait for the weight to to support us. But we have the power, we have the money, so members have started contributing for this cause, because the community is ours, the organization is ours, and we have benefited a lot. It has empowered us, it has brought us from very far, deep in the hotspots, and we are somewhere. So we are encouraging that, and our members are contributing. It is called the FIRE program. That program really came at a point where we're in that saga. And those trainings helped us to enhance our skills in fundraising, to enhance our skills in identifying flexible donors. The trainings helped us to reserve fund. Because previously that is something we're not, we had not planned or thought of. But because of what happened, we saw there was a need. So we have started building our reserve fund. We have started building our reserve fund. We have now, we do donor mapping. And in the process, we have at least brought on board some few partners to support because of the experience that we got. Then we also use cost-effective approaches in our work. For example, the online engagements, you cannot tell members that we cannot come there because we don't have transport. You organize a Zoom meeting because some of our members, the peer educators, for example, they have smartphones. So you can connect with them. So even the engagements with the other stakeholders, if you don't have money or funds for physical meeting, you organize a Zoom meeting, and even if it is a capacity building, you can use online platforms to ensure that you connect with people and you have discussed all that you want to discuss. When it comes to digital technology, we are now embarking on digital advocacy, because it doesn't cost a lot of money, like going to TV, going to radio, they charge a lot of money. So we are using cost-effective methods. And we are also trying to engage everyone on board that can support us, the private sector. Those people have money, they are in business, they are making profits. But previously, we had not even thought about them. But some companies, they have this corporate social responsibility. So when you partner with them, they can. So we are trying to identify who can support us in this cause. And for example, I can give an example of the brothel owners and managers. Previously, we had worked with them, but we didn't know that these people can really support us. They can support us, they can do even the mobilization for us. They can even sensitize our members. So what we are doing, we are sensitizing them first. When it comes to SR/HR issues, we are sensitizing them. And they are supporting our members. They are referring them for health services. They are supporting them to report cases at police, the lodge owners, the brothel owners.
Just wanted you guys to get just a sense of the breadth of ideas and new strategies and creativity, that's coming out of the sex worker movement right now. So that is our panel, and we have lots of time for questions. So I'd love to hear from any of you. Yes, there in the back.
I've been so dying to ask how you worked out the finances around the home. Were they paying rent for a while? Was that going towards the mortgage? Who put it up in the first place? That would be a fantastic model for more of us to hear about.
I actually like talking about this. It's something that we pride ourselves on. There have been some women in development in Memphis, and I'm not gonna say some, one woman in development in Memphis who has, had lunch with me to talk about the future of MSH and how we can scale our work by working with banks. But we have not worked with banks. We pay for our land cash, and we paid our developers cash. So we don't owe anybody for the homes. So they're putting money directly back into our fund to continue to build, to continue to acquire. Because with a lot of funders, they don't want us to acquire land. They don't want us to do new construction or renovation. So
whose name is on the property when you buy?
my sister's house.
As an organization?
As an
Oh,
organization.
okay. Yeah, that works. And so then you just make a decision about how long how much they put back in. How do you decide when it transfers ownership to the people?
So it's really derived from how much it cost us for the land and to develop the home, and that's all they pay us back. And it's basically fair market value. So it's set up like a community land trust where people can either sell it back to us, which we probably won't have the money to buy it back. So they'll be buying the house, and if they wanted to sell the house and they're well within their rights to do, we also just ask them like on an honor system, like sell it for fair market value so that it stays affordable and don't sell it to an investor.
But so you mentioned the word 700, well, the number 750. Are you taking like 750 times 20 months equals, I'm just trying to calculate. So it's actually payment towards the purchase every single month. That's.
We have some smaller units that are like $385 and $400 a month, and those are for folks who are on like fixed income, whether that's SSI or they just have low income, period, because a lot of places in Memphis, the minimum wage is $7.25 in Memphis right now. So a lot of people really can't afford housing at all. So those smaller units, we have 5 of those that are like $385, and they go from $385 to maybe $450 a month.
And is it usually one person?
And it's all one person. We have some trans families in our larger houses. We have some elders who have their children who live with them as well. Most of our units are 1-bedrooms. We have some studios that are transitional, and we have some 3-bedrooms.
But that's part of your genius. You didn't set up co-ownership because that sets up so much possible stress. So there's just either a family or an individual who own it.
Yeah, and the stress for us is coming on the back end. Like for me personally, I'm like, I want people to be ready to own a home, and not just they own the home, but how to pay their taxes and what happens if you don't pay your property taxes. And repairs, and having a contingency fund for that. Being able to save for the unknown, because there's gonna be something that's gonna come up major, because we have that happen all the time. And the 3 people and their families that are about to purchase their homes, we're actually like going through their house and doing really deep inspections with our contractors to make sure that we're giving them a sound property. That most people have a home inspection, so we're trying to go and through that process now leading up to it so that we're identifying any major issues that could possibly come up. The houses that we have that are built new, they come with a 2-year warranty from our builder, of course. But after that, we have small issues like if there's a storm and a weatherhead falls down, we take care of that. If light bulbs go out, they take care of light bulbs. But if it's an electrical problem, we take care of the electrical problem. If it's a mechanical problem or a plumbing problem under the house, we've The infrastructure in the city of Memphis is not great, especially in Black and brown communities, and that's what we're building at. They have not been taken care of. So we have found that once we built a house, one of our homes, we had to go underground and do about $10,000 worth of work. And that's something like we would rather do that now than you take ownership of the home and 5 years down the line, there's this big issue and you're like, out of your mind crazy about it, and you're not telling us about it. We've had that experience with a lot of folks. That's why we start folks off in our transitional units that are smaller, then they move into our larger units, which is more permanent. But the transitional time, the time they spend in the transitional units gives us an idea of what type of renter's trauma they're dealing with, because a lot of our folks, all of our folks have dealt with that, where they're like, oh, I'm not gonna tell my landlord about this leaky faucet because my last landlord ain't never fixed nothing. And I have to remind folks, we're not them. Like, we're not them. Tell us. We don't live here. We don't, come in your house every week or every month or every year. So you have to be open and have a really good communication with us. We started another program last year, which is our tenants' rights program, which kind of just helps them to build a rapport with Michelle Anderson, who is one of our longtime residents. She's one of the people who's going to purchase her home next year. But building a relationship with somebody outside of me, because they call me the landlord. I need another name. If y'all got another name for that, please, because I'll be like, don't call me that. Like, call me a friend, or don't call me, because there's a bad negative connotation around landlords. And I'm like, that's not what I am.
Yeah. Thank you. Yeah, it's just so interesting to get into the weeds of how to actually make something like this work. I saw you had a question. Yeah.
Yeah, mine's much broader on the topic of sex workers in general, because that's what we're talking about. I think one of the barriers to funding that we've talked about a lot is that governments and private donors are unwilling to fund sex worker organizations, and a lot of that, I think, comes from a lack of understanding of sex work as a profession. So I guess my big overarching question is, what, in your experience, is the best way to explain sex work as a legitimate profession to people, especially looking at older adults or people who don't have as open of a mind to this kind of acceptance?
Beautiful question. Yeah, I bet we could all speak to that a little bit, but do you want to get it started, CJ?
Well, and I might have a get a load of this, as we say in the third wave world. But my get a load of this is that it might be an unpopular opinion, but or just unthought of thing. Is like, for me, it has been learning when and who to say it to, because you might not be wanting to say it in some people, but the cool thing about sex worker organizing and work led by sex workers is that it's not single issue ever. And so, yes, you might be organizing as a sex worker, but maybe you could be applying for money through gender justice or racial justice, or not to put it in a different face, but really look at what you're doing and think about what are the other intersections here of the people that this work is affecting, because it may not be safe to put that on every application, especially now. And I don't want you to think that there's any way you can nonprofit your way out of that, because some people, it will be an absolute no. And some folks won't even tell you that there is the stigma or bias or outright there, especially when it comes to folks that are funding cultural work, specifically things that are related to storytelling and narrative change. Those arts-based organizations won't say don't put sex work, but if you put it on there, you're not getting the grant. So yeah, I would really like, that would be my offering, is like when and who, and then like that will also tell you like if this money is safe to take or not, which our friends from Uganda also spoke about, of like being like, well, this was a boundary, so we're not taking this money. Or like, we conformed here because we had to take this money.
Yes, for sure. I think something that works for us a lot is talking to your funders. I think sometimes it's easier for them to give to us and they don't know where the money is going, and then we subgrant as a intermediary, but also we invest a lot of time in donor education. I think people like being in the same room as who they're funding and talk to them. I think it changes the dynamic when something is a concept versus somebody sitting on a panel saying, I'm a sex worker. I do it for my choice. I chose to do this for XYZ reason. And I think that changes the dynamic a lot. So I think that's really important. I think having conversations directly with the communities themselves changes that conversation.
I want to say one thing about that question, and then you're next. We have actually a toolkit that is intended to be a good starting point to open up these conversations with people who may have a variety of opinions or feelings or emotions or personal experiences that lead them to feel very strongly about sex work one way or the other. And it's called From Do No Harm to Inclusion, because we believe that everyone can at least commit to doing no harm to sex workers if we at least share some values. So that might be something helpful to look at on our website. Yes, my dear.
I just wanted to add on what you asked.
Oh, great. Yeah.
Yeah, me as an activist, and
Yes.
also seeing my colleagues speak from Uganda. I remember when we were starting to do advocacy with McLean, it was really hard to go in those spaces of the governments to speak. But later on, and we the British government came and they were giving money to the Ugandan Commission so that it comes to sex workers.
Yeah.
But there were questions. These rich people were asking, but we know sex workers. Sex work is work. These sex workers have money, they have license. Are they taxpayers? Are they paying taxes? They have licenses. What's that? But then one of the things at the break, we went down and we took a breath and McLean said, what we have to say? We are not saying we need money, but we need programs to support our capacity building. We need services. We want to train sex workers to know their human rights, because it is hard. When sex workers go to get services, they are stigmatized, they are violated. You can't openly say I'm a sex worker. Before you couldn't say that in the Ugandan government. But what I saw is they have done a lot of work, and sadly I'm not there to see our fruits of what we did before. I just wanted to contribute.
Yeah, thank you.
Yeah, I'm so excited you're here to kind of bring it full circle, Beyonce. Maurice, yes.
Yeah, something I just wanted to add as a question and sort of invitation is, so when we were starting the sex worker giving circle at Third Wave, one of the things, I'm a former sex worker, organized with some people in this room many, many years ago here. And for me, one of the things that I love about sex worker organizers is that our skills from doing sex work translate so beautifully to fundraising, especially with individual donors. Background checks, prospecting, right? That spidey sense, this person is trustworthy versus this person, watch the fuck out, excuse me. But those skills and seeing in real time, it's one of the most meaningful things in my life to see those skills be transferred, and your business acumen, the way that you're able to hold all these different moving parts, those are beautiful skills. And so another thing I just want to offer is hire sex workers. The skills are powerful, and I'm really proud that I think a lot of the sex work donor collaborative orgs have been doing that. So stepping off my soapbox, I'm wondering how, and specifically thinking about for you and for other folks in the room, does that ring true for you? And basically, does that ring true, and how have you seen that play out?
The question around transferring skills from being a sex worker to trying to fundraise for your organization, organizing. Yeah, that's a great question.
Such a good point, Mavis. And I think this is where what you said, CJ, about participatory grant making is so important, because it creates a pathway for communities to come into philanthropy. I think this is participatory grant making is how sex workers have been able to decide where the money goes, and then also create a pathway for themselves into philanthropy. Otherwise, how a funder looks like will never change, and you'll never see brown and black people doing funding. I was a part of the Red Umbrella Fund's Program Advisory Committee, which was their participatory mechanism, and that was my entry into philanthropy as well. So I think this is why more and more funders need to do participatory grant making so people can learn philanthropic skills as well to read proposals, to identify what to fund, where to fund, to create more pathways for themselves as well.
I would say absolutely. Especially with our individual donors. I have Zoom meetings with them, and it's kind of like video calling. Except I get to keep my clothes on. Well, yeah, a little camera action. And those are the funders that we really appreciate because they drop the money off and get gone, go back to their families, their job, whatever it is they hold really sacred. They go back to that thing and they leave us alone to do the actual work. So I will say that some of those skills have transferred. Another thing is community building, because we have to build a safety network when we're like, I was a street level sex worker. I'll do a little online, but I prefer to be on the beaten path, so people can see me. And building safety networks on the streets, it's kind of hard, especially if you're a new girl and people are like, oh, we don't know her. We're not going to tell her about the regulars who are safe, who pay good money and things like that. And that's what I've done with all of the connections that I've made over the years of doing nonprofit work, and it's been probably about 13 years now, is sharing that information with other nonprofit leaders who have come out of sex work. Like, this is who you can talk to. This is how you talk to them. We talk about our work a lot because we're in Memphis in an environmental lens, because we are dealing with XAI. We've been dealing with it for a few years now. A lot of our homes are in South Memphis, which is about 3 to 5 miles from the first plant that was put there. So that's how we talk about our work. This is an environmental issue. This is this is a project that will impede upon gentrification in Memphis, unlike our state capital, which is Nashville, and it's like gentrification city, and Black people and brown people have been pushed all the way out into Murfreesboro. They're coming back to Memphis. They're going to Jackson, Tennessee, but they're not able to stay where they're from. And what we're trying to do is rebuild South Memphis. It's a street that I grew up on where most of our houses are, and we're bringing people who are from South Memphis back to South Memphis. We're not bringing new folks who are not familiar. They don't have no ties, no connections, and they may feel unsafe. So yeah, I'll just leave it there. They are transferable, and they work. They really do work. And I'm going to second that. You definitely need to hire sex workers in your organizations, whatever kind of organization that is. Like the participatory grant making model is great. I've told a lot of folks today and prior to today that I've been a part of a lot of advisory councils and participatory grant making with a lot of different foundations and organizations that do funding in and out of our community. And I think, and I know that's going to be my next phase, is to be a person who is sitting in these seats on the end that are actually funding mass organizations across the nation and hopefully globally. So yeah, having people in these spaces who are actually directly affected by what we're trying to impact is really crucial, because we know the roadmap to get to the people who actually need the resources.
I'm just gonna echo what everybody has said, and name, to your point, Maurice, I think what you're naming with transferable skills and something I clocked when I was a fellow that was really unlocked for me in our Philanthropy 101, which is where we really break down what is philanthropy in what I call a bimbo-friendly way, so that the sex workers in the room like me can understand what the hell is going on. But what I learned from that is that street economics only scale up. So if you can understand street economics as a sex worker, you can understand the nonprofit industrial complex. You can understand the philanthropy industrial complex. You have some work to do in learning the language, but you already know the systems, and that has just been such a testament to my own journey, being able to clock, I'm talking to a fiscal sponsor and having this reference of they kind of operate like a pimp, right? So when I'm talking to a grantee's fiscal sponsor, I know I'm talking to their pimp. I'm talking to the person that controls their money. And it influences the way that I interact with them, right? When I'm talking to a grantee, I know that they just did an interview that was just like them being a cam girl, right? And so there's a sensitivity there that I have in that interview space, so you ain't gotta dance for me in this room. You ain't gotta dance for me. You might have to dance for them out there, but you don't have to dance for me. So yeah, I think the skills and the systems, not only are the skills transferable, but it speaks to the fact that the system is it's pimps and hoes from top to bottom, you know?
I just want to add, yes, fiscal sponsors are pimps.
And we don't hate all our pimps, you know?
And we don't hate all our pimps. And that's another way that we've been able to obtain a lot of funding and support for the project is because we are fiscally sponsored by a cisgender-led organization that does reproductive justice rights. They're in Chicago and in Memphis. And I know that a lot of spaces have made it easier for us to obtain resources because there's a pimp who has a proven track record of making sure they keep their hoes in line. So.
Yes, Penny.
This is kind of a comment and maybe a question, but in terms of speaking to funders or sharing what we do, I mean, I know at best practices, like, we get up every day and feel like, oh, we didn't do such a good job in that situation, so we have to do a better job. And then when we, like it's this internalized homophobia or stigma, right? So, but when we analyze the situation, we realize, wow, we really did a lot better than like the mainstream funded groups, right? So a tiny example was when the US Human Rights Network was going through a lot of troubles and needed to move its board into another place and all kinds of things were going on. We as sex workers from our coalition, we got involved and we were the most organized and and we felt like we were losers at the beginning, but by the end we were like, wow, the US Human Rights Network really needed us. So it's a constant process of reminding ourselves that. And when speaking to a potential donor, I think we should have a sense of pride in the excellence of our work. We do great financial statements. We got our UN status. Like every sex worker-led organization has achievements, all the housing, and I think sometimes we kind of creep back on that because there's a feeling that we will never be like the mainstream people. But I'm here to say, and I might have my sex worker lens on, that we so often are better, right? So I think we should do that more. So that's what I would contribute to you. Like, what can we say that we did excellently, hand on heart, and it's not just a spin, because it's all true. And to throw it back to the panelists, does, as Marie said, does this resonate?
That's how you turn a statement into a question. Yeah. Oh, can I speak to it really? Not to speak for our Ugandan people on the screen, but like one thing that really struck me about what they were talking about, I hope it came through in the clips, is that like sex workers have built the healthcare system in really hard to reach communities, and they even without the funding being taken away, they're like, we're going to keep finding a way to deliver these healthcare services, not just to sex workers, but to anyone who needs them. And so they really have, like you said, they're doing it, and with or without support. And without sex workers in this situation, where would people be, really? So I was really glad to hear that example. Without my sister's house, who's gonna fight gentrification on this street by street level, and make sure people have housing? So it really is true.
I just wanted to shout out BPPP. Like Best Practice Policies Project, I think every time they show up in our application pool, the fellows just resonate with what y'all do in that interview room because of the way that y'all show up. And it is, right, like being able to speak to what you do well quickly because you typically don't have that much time, right? And as sex worker or as sex workers in general, I feel like there's so much that we're doing well, but like, what are you, like you said, hand to heart, 10 toes down, we nailed this, and like everything else will come from that. So yeah, I just honestly wanted to shout y'all out because I just really appreciate y'all in the room.
Well, that is a wrap. And thank you all for coming late at night. I hope you're taking some inspiration home with you. There are some resources. Oh, they might have all been taken. A few more resources about the funding crisis that we were talking about. If you want to grab a report, come up, say hi, and thank you all for coming.